There's a kind of danger that doesn't make a sound. It doesn't scream. It doesn't throb with pain. Sometimes it doesn't even feel like danger at all. You might be sitting in your favorite chair, sipping tea, watching a grandkid laugh in the backyard. Everything feels fine. Until, suddenly, it's not. That's how strokes from atrial fibrillation often arrive. Quietly. Not from blocked arteries. Not from sky-high blood pressure. But from something far sneakier. A rhythm problem in your heart that whispers, not shouts. AFib. You may have seen the name on a commercial. Maybe heard someone at the clinic mention it. But most people don't know what it is. Or that it's one of the leading causes of stroke in adults over 60. The scariest part? You can have it and feel nothing at all. No pain, no warning. Just one silent misfire in your heartbeat. And a clot that travels straight to your brain. In an instant, everything can change. Mobility, memory, speech, independence. But what if knowing the signs, checking your pulse, asking your doctor the right question, was all it took to catch it in time? In this video, we're going to unpack the truth about AFib. What it is. Why it becomes more dangerous after 60. And how small, simple steps can protect your brain, your future, and maybe even your life. Because even when your heart doesn't hurt, it might still be trying to tell you something. Are you listening? So, what exactly is AFib? AFib, short for atrial fibrillation, is the most common type of irregular heartbeat in older adults. It's not always painful. In fact, it's often silent. But the way it disrupts your heart's rhythm can set off a chain reaction that ends in a stroke. Let's break this down simply. Your heart is a pump, but it's also a conductor, keeping a steady beat, like music. Every beat starts with an electrical signal in the top right corner of your heart. This signal tells the upper chambers, the atria, to contract and push blood into the lower chambers, the ventricles. Then another signal tells the ventricles to squeeze and send that blood to your lungs and your body. When everything works smoothly, your heart beats with purpose, about 60 to 100 times a minute. Steady, reliable, efficient. But in AFib, the signals go haywire. Instead of one clear rhythm, the atria are flooded with fast, chaotic impulses coming from different spots. Instead of beating, they flutter, quiver, like a drum being tapped too many times at once. And when that happens, blood doesn't flow the way it should. It stalls. It pools, especially in a small pocket called the left atrial appendage. And when blood sits still, it can clot. This is the heart of the problem. No pun intended, because if one of those clots breaks loose and travels to the brain, it can block blood flow. And that's how AFib leads to strokes. Not because your arteries are blocked, but because your heart's rhythm is broken. Now here's the twist. Some people with AFib feel it as a flutter, a skipped beat, or a pounding in the chest. But many, especially older adults, feel nothing at all. You could have it for weeks, months, or even years without knowing. Instead of heart attack pain, you might just feel a little off, a bit tired, a bit foggy, maybe some shortness of breath. But because these symptoms are so vague, they get brushed off as just getting older. But aging isn't the problem. AFib is. And the more we understand how this condition hides in plain sight, the more power we have to stop it before it steals something precious. Because AFib doesn't just mess with your heartbeat. It messes with how your brain gets blood. And when the brain doesn't get enough oxygen, even for a few minutes, the damage can be lifelong. So instead of waiting for something big to go wrong, Isn't it smarter to catch something small that's already out of step? Let's keep going. Why does AFib become more serious as we age? It's not just because we're getting older, it's because the heart itself is changing. Over time, the walls of the heart, especially the upper chambers, can become thicker and stiffer. Scar tissue can build up. And the natural electrical wiring inside the heart, the same system that kept your rhythm steady for decades, can begin to short-circuit. So instead of sending clear, steady signals, your heart starts sending mixed messages. Instead of marching to a beat, it starts to stumble. That's when a fib sneaks in, and it's not coming alone. Because aging rarely travels alone either. High blood pressure, diabetes, sleep apnea, thyroid changes, even kidney issues. These conditions don't just raise your risk for a fib. They make it worse when you already have it. And here's what that means in real life. A person in their 70s with AFib and high blood pressure is far more likely to suffer a stroke than someone in their 40s with the same irregular rhythm. Why? Because the older heart is already working harder. The blood vessels are less flexible. The brain is more sensitive to changes in oxygen. And if a blood clot from the heart blocks even a small artery in the brain, the damage is faster and often deeper. But that's not all. AFib can be harder to detect in older adults because the symptoms don't always scream for attention. You might feel tired, or just off, maybe a bit winded going up the stairs, and it's easy to say, "That's just my age." But sometimes it's not. Sometimes it's your heart trying to whisper before it yells. And the older we get, the more serious the consequences. Studies show that strokes caused by AFib in older adults are more likely to cause long-term disability. We're talking about losing speech, losing mobility, losing independence. And once that happens, recovery is often slower, harder, more complicated, not just for you, but for your spouse, your children, your caregivers. Because a stroke doesn't just affect the body, it shakes the whole family. Even treatment decisions get trickier with age. Blood thinners reduce stroke risk, but they also carry a risk of bleeding. For someone who's frail or prone to falling, that matters. It means doctors have to walk a fine line between protection and safety. And you need to be part of that conversation. But here's something we don't talk about enough: emotional health. The fear of another episode. The anxiety of not knowing when your heart might flutter again. It can make you avoid activity, stop walking, sleep less, worry more. And that creates a downward spiral that only makes everything worse. That's why we can't afford to ignore AFib after 60. Because this isn't about fear. It's about preparation. It's about protecting what matters most: your time, your clarity, and your independence. And that begins by listening to what your heart and your body might already be telling you. So how would you even know if you had AFib? That's the hard part, because not everyone with AFib feels it. Some people do. They might describe a flutter in the chest, a skipped beat, a racing heart out of nowhere. These feelings can come on suddenly, or come and go. If you've ever felt your heart beating fast while resting, or thudding unevenly for no clear reason, that's a sign you shouldn't ignore. It's not just stress. It's not just one of those days. It could be your heart asking for attention. But what if you don't feel anything at all? That's the reality for many older adults. AFib is often called a silent condition because it hides behind symptoms that are easy to blame on aging. Fatigue, shortness of breath when doing something mild, like climbing a few stairs or walking across the room, feeling lightheaded or dizzy without a clear cause. Sometimes it's just waking up tired even after a full night's sleep, or noticing your energy isn't what it used to be. You tell yourself, that's just getting older. But maybe it isn't. Maybe it's your heart not pumping efficiently. Maybe your brain isn't getting quite enough oxygen. And in some cases, the first sign of AFib is the stroke itself. No warning, no flutter, just a sudden fall, a lost word, a face that droops. By then, the damage is done. That's why paying attention now, before something happens, can make all the difference. Because instead of waiting for pain, what if you listened for patterns? Instead of brushing off that shortness of breath, what if you asked your doctor about it? Instead of thinking, this is just aging, what if you paused to ask, could this be something more? Here's something simple you can do. Place your fingers on your wrist or neck. Count the beats for 30 seconds. Is it regular and steady, or jumpy and uneven? That 30-second check could be your first clue, because even when you don't feel sick, your heart may still be out of rhythm. And when it comes to AFib, rhythm is everything. It's what keeps the blood moving, the brain fed, and the risk low. So the next time you feel a little off, stop, breathe, and listen. Not with your ears, with your fingertips, with your awareness. Because your heart doesn't always shout, but it will whisper. And if you learn to hear it, you just might catch something early enough to change everything. If AFib can be silent, and if symptoms aren't always clear, then how do you know if you have it? That's the question that saves lives. Because AFib isn't something you wait to feel. It's something you go looking for, especially after 60. And the good news? There are simple, accessible ways to start checking. It often begins in your doctor's office. During a routine visit, a nurse may feel your pulse and notice something's off. Too fast, too slow, or not steady. That tiny moment of curiosity could lead to something big. A test called an electrocardiogram, or ECG. An ECG is quick, painless, and takes just a few minutes. Small electrodes are placed on your chest, arms, and legs. They pick up the electrical signals of your heart, like listening to its beat on paper. If you're in AFib at that moment, it will show. But AFib doesn't always cooperate. Sometimes it comes and goes, what doctors call paroxysmal. You could be in perfect rhythm at the office and fluttering hours later at home. That's why many people wear monitors, small devices that record your heartbeat over time. A Holter monitor tracks your rhythm for 24 to 48 hours. An event monitor can last up to 30 days and activates when you feel something strange, or when the device itself senses irregular beats. And for those with hard-to-catch symptoms or a stroke with no known cause, there's something more advanced. An implantable loop recorder. It's the size of a USB stick, slipped under the skin near your chest. It records your heartbeat 24/7 for months, or even years. For older adults, especially those with a history of stroke or memory issues, this tool can be the difference between uncertainty and clarity. But you don't always need high-tech tools. Technology at home is changing the game. Some smartwatches, like certain Apple or Fitbit models, can now take an ECG right from your wrist. There are also pocket-sized devices like CardioMobile that let you check your heart's rhythm in 30 seconds and send the results to your doctor. Are they perfect? No. But they give you something powerful, a way to notice changes between appointments. And if that feels too complicated, here's the simplest test of all. Your fingers. Take a moment each day. Feel your pulse. Is it strong, regular, smooth, or is it skipping, jumping, hesitating? That's your clue. Because AFib doesn't start with an ambulance ride. It starts quietly, with a misstep in the rhythm. And when you catch it early, you gain time. Time to ask questions, start treatment, and prevent what might have felt inevitable. Instead of waiting for a stroke, you're watching for the signs. Instead of reacting to damage, you're preventing it. So ask your doctor. Ask about rhythm screening, even if you feel fine. Especially if you feel fine. Because silence isn't safety. And peace of mind comes not from guessing, but from knowing. Now that we understand how AFib works and how to spot it, let's talk about why it matters so much to catch it early. Because AFib's biggest danger isn't the rhythm itself. It's what that rhythm allows to happen inside your heart. It's the blood that pools, the clot that forms, and the stroke that strikes, often without warning. Here's how it works. When the upper chambers of the heart, the atria, quiver instead of pumping, blood doesn't move the way it should. It sits. It swirls, especially in one small pouch called the left atrial appendage. And when blood sits, it clots. Now imagine one of those clots breaking free, traveling up through your bloodstream, and lodging in the brain. That's what causes an ischemic stroke. It's not slow. It's not subtle. It's sudden and often severe. People with AFib are nearly 5 times more likely to have a stroke than those without it. And the strokes they suffer tend to be more disabling. Why? Because the clots are often larger, more solid, able to block major vessels that feed large parts of the brain. We're not just talking about weakness or numbness. We're talking about losing speech, losing memory, losing the ability to live independently. And for many, it doesn't happen during exertion. It happens during rest, in the middle of the night, while watching TV, while napping. That's why we call it a silent threat. But here's the part that gives us power. You can reduce your stroke risk by up to 70–80% with proper treatment. So what does that treatment look like? It starts with medications, specifically blood thinners, also called anticoagulants. These don't fix the AFib, but they prevent clots from forming inside the heart. The traditional choice has been warfarin, which requires frequent blood tests and food restrictions. But today, most older adults benefit from newer options called NOACs, novel oral anticoagulants, like apixaban, rivaroxaban, and dabigatran. These are easier to manage, no regular blood checks, fewer food interactions, and in many studies, they're just as effective, or more so, than warfarin at preventing strokes. Now, some people worry, but don't blood thinners raise my bleeding risk? Yes, they can. That's why your doctor weighs the risks and benefits using tools like the CHA2DS2 VASC score and HAS-BLED score. But here's the truth. For most people over 60 with AFib, the benefit of preventing a life-altering stroke far outweighs the bleeding risk. And for those who truly can't take blood thinners, due to past bleeding or medical concerns, there are other options. One of them is a procedure called left atrial appendage closure, using a device like the Watchman. It seals off the area where clots typically form. It doesn't eliminate the need for all medication, but it can significantly reduce stroke risk in select patients. Bottom line, instead of fearing a stroke, you can actively prevent one. Instead of waiting for something to go wrong, you can take steps to keep things right. Because when it comes to AFib, early action doesn't just save time. It can save speech, mobility, memory, and independence. And that's what we're really protecting. Your ability to make your own breakfast, to drive to the park, to remember birthdays, to be you. Not just alive, but truly living. Let's be clear, AFib doesn't mean your life is over. It means your body is asking for help. And the way you respond doesn't just shape your risk, it shapes your future. Medical treatment is essential. But what you do each day? That's where the real transformation happens. So how do you live with AFib, not under it? Start with movement. You don't need to run marathons. But walking 20 to 30 minutes a day? That's powerful. It helps control weight, reduce blood pressure, and calm your nervous system. Instead of saying, "I'm too old to start," try asking, "What can I do today to stay steady tomorrow?" Then look at sleep. Many people with AFib also have sleep apnea, where your breathing stops and starts during the night. This strains the heart and triggers rhythm issues. If you snore loudly or wake up feeling tired, even after a full night's rest, talk to your doctor. Treating sleep apnea doesn't just help your energy. It helps your heart stay in rhythm. Now, let's talk about what's on your plate. Instead of salty snacks and processed foods, try more leafy greens, berries, and lean proteins. Instead of sweet sodas, even diet ones, drink more water or herbal tea. Foods high in sodium and artificial sweeteners can impact your blood pressure and rhythm control. And while we're at it, let's talk alcohol. Even a few drinks can trigger AFib in sensitive hearts. So instead of that nightly glass of wine, ask yourself, is this helping my rhythm or working against it? Then there's stress. You may not be able to avoid every worry, but you can change how your body responds. Simple habits like deep breathing, meditation, or sitting quietly in nature, even for 5 minutes, can reset your nervous system. Because AFib isn't just physical, it's emotional too. When your heart feels out of sync, your confidence can go with it. So build routines that give you a sense of calm and control. Call a friend. Take a walk. Listen to music. Laugh. And don't forget the most overlooked habit of all: taking your medications exactly as prescribed. Not most days. Not just when you remember. Every day. Every dose. Because a missed pill can be the difference between peace of mind and a preventable emergency. Living with AFib means living intentionally. Instead of thinking, "I'll deal with it later," remind yourself, every small step today shapes how strong I'll be tomorrow. Because this isn't about avoiding decline. It's about building strength, one heartbeat at a time. If you've stayed with us this far, then you've already taken the first step. Awareness. AFib is real. It's common. And yes, it can be dangerous. But it's also treatable. And stroke? It's preventable. Instead of seeing AFib as a sentence, think of it as a signal. A reminder that your heart is still speaking, and that it's never too late to listen. You don't have to be perfect. You just have to be present. Present to your rhythm, to your routine, to the things that bring your life meaning. So check your pulse, ask questions, take your meds, move your body, and share this message. Because someone you love might be walking around with AFib right now and not know it. What you do today could change everything for them and for you. Your time matters. Your mind matters. And your heart? It's still beating for a reason.